providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. It's February is American Heart Month, so it's a good time to talk about all things heart. That's why I wore my red shirt today. I missed it on, Wear Red Day, but today's going to be my Wear Red Day because I have an interventional cardiologist in the studio. I have Dr. Houman Khalili with me this evening. Dr. Khalili, how are you doing this evening?
Good, very well. How about yourself?
Great, thank you, and thank you for joining me. I always say on this adventure of health and, of course, heart health. Lots going on with, the medical care for the heart and all that's going on. I mean, I just a few years ago didn't even know, probably 10 years ago, I didn't even know what an interventional cardiologist was, and now it's something that's kind of common to say, you know. So there's a lot of you, which is great because you do great work. So I always start out with doctors. Tell me a little bit about your medical specialty because interventional cardiology, if people don't know exactly what it is, it would be a little difficult to understand, right?
Right. So there's general cardiology and general cardiologist. I'm an interventional cardiologist as well as a general cardiologist. And general cardiologist takes care of patients with heart problems, heart disease, heart attacks, coronary artery disease, which is blockages in the arteries of the heart, or valvular heart disease, problems with the valves of the heart, and that sort of thing. And we take care of it with medications. As interventional cardiologist, not only we take care of patients with medications, but if need be, we use catheters to fix certain ailments of the heart. So if someone has a blockage, for example, we try to fix that with catheters. If they have valve issues, we try to do something with catheters to kind of alleviate the patient's symptoms. So that's interventional cardiologist, and it's somewhat of a less invasive approach to heart disease. We're not quite surgeons. The surgeons do open heart surgery, but we try to do things we are less invasive. We can talk about that later. We are less invasive kind of approach.
That's a great definition of it. I like how you explained. It's not open, that the heart surgeons or cardiac surgeons or cardiothoracic surgeons.
That's right.
They're called a lot of different things there. I just realized. But yeah, they do open. So
yes.
Was it kind of the evolution of that type of care that kind of went this way because obviously an open procedure is a little more extensive, can be tougher on the body as well?
That's right. So yeah, open heart surgery, and they've improved on it quite a bit. Cardiac surgeons have, but nonetheless still involves a lot of recuperation and a lot of physical therapy, etc. after the surgery. Whereas the less invasive approach with catheters and what we do as interventional cardiologists, the recovery from it is a lot quicker. There are cases where a patient would be better off getting a surgery, but there certainly have been more and more now cases where we can intervene with a less invasive approach, and hopefully a patient can get back to their daily living a lot quicker.
I think it's amazing the options that are available today. Like you as a doctor can consider, if it would be better for an interventional approach or an open approach. That is just amazing because I'm sure years ago that that was a little different. You know?
Those options might not have been available, right?
Yeah.
It was either you get surgery or you couldn't get surgery and that was it. There were no other options. But now we have all sorts of different options available for each individual patient. So we kind of individualize care depending on the situation.
Yeah, and like we always say on this show, we have doctors on the show. We hear a little bit about cases here and there, but every case is different, and I think that's great with the care, especially cardiology care going on today. There's so many. When you have a lot of tools in your toolbox,
Right.
it's easier to do the work, right? You can get the work done. So that's amazing. I'm going to give out Dr. Khalili's info a few times this evening. You may recognize him because we were just at the wellness fair by Delray Medical Center at the South County Civic Center. My old stomping grounds. I used to be a reporter for the Sun Sentinel and the Delray Forum weekly newspaper, and I used to spend a lot of time at that South County Civic Center. That is a unique hub there in I guess it's kind of West Delray. It's a little west.
Yeah.
But wow, what a turnout.
It was a fantastic turnout.
Yeah.
It was great.
Amazing job by Delray Medical Center. Dr. Khalili was there. You had the transcatheter therapies booth. I think that was the name of it.
That's right.
And you got to a lot of people got to stand in line and
ask
talk
questions.
to you.
Yeah, it was great. It was fantastic.
Yeah, I was watching. You got a lot of questions that day, quick. But one thing I like about you, you're a great young interventional cardiologist, but you're very approachable, and I think that's that's important. Because this time in someone's life when they have a heart issue, or even for the family, communication is so important. And when you can communicate with a doctor and have that, kind of connection, I think that, means a lot going a long way.
Yeah, like you said, I mean, if because of the number of options available, however you can treat all these different diseases, it's important to kind of have a good comprehensive understanding of the options and treatments approaches that are available. So if you got to be able to talk to your doctor and have that open. Otherwise, if you can't really communicate with them, you don't really have a good grasp of what's going on with your body, and you don't really know what is the best approach to treatment. So that's very important.
Yeah, because sometimes the more the doctor knows, the easier it is to make certain decisions or get the job done. Or if not, you're like an investigator and you have to find certain things out. Yeah. But you always figure it out. So Dr. Khalili is now at the Delray Medical Center tower. That's at the beautiful $90 million renovation there at Delray Medical Center. Every time I go by there and go inside, I'm just amazed. But you actually have an office now in the hospital.
Yeah, it's a great facility. It's very nice. It's very convenient, I would say, for patients. So if there are any procedures that we want or any testing, it can be done right there. So it's very nice.
Well, let's talk a little bit about, we got 11 viewers on Facebook Live, so glad to see that. If you have any questions, the number is 888-565-1470. We'll get, them in front of Dr. Khalili, or you can type them there on Facebook. I'll try to see him there. But yeah, Dr. Khalili's located at right there at the Delray Medical Center, Tower 5352, Linton Boulevard, Suite 100, Delray Beach, with an office with Tenet, Florida Cardiovascular Care. The website is tfccheart.com. I'll give that info out again. But what I was getting to, a lot of our viewers and listeners are obviously the baby boomer population. So what is some of the type of care you offer for that population? Every population is different, obviously, but, the baby boomers and then on to senior citizens and our elderly population here in South Florida.
So the particular care that I provide, a structural heart, is, and we can get into that a little bit later. That is really a kind of sort of care that we provide for the baby boomer population. And what that is baby boomer population typically has a high prevalence of valvular heart disease, aortic valve disease. Those are the valves of the heart that regulate blood flow through the chambers of the heart. So those valve functions can deteriorate over time, and they can either become stenotic, which means they don't open well, or they become what we call regurgitant, which means they start leaking. So if they start having those problems, then patients can experience symptoms like shortness of breath or chest pain, that sort of thing. So they come to see us, they come to see me. So those are the sort of cares that I typically provide for those patients. Either medical approach, appropriate testing, what do we do about those, those type of situations, and what treatment options are available. So for baby boomer population, that's the most type of disease and illness that we kind of deal with.
Well, we already got a caller, so I see that Howard's on the line. Howard, you got a question for Dr. Khalili? We'll put the interventional cardiologist on the spot here.
Okay, Doc, how you doing? I'm going to need an aortic heart valve shortly, and I'm a 67-year-old, healthy male, and I really wanted to do the TAVR treatment because it seems so much less invasive, but they're trying to talk me out of it, saying the open heart surgery, they could put in a better valve, and since I'm healthy, it's a better route to go.
Right.
What are your thoughts about that?
That's an excellent question. So for those who don't know, transcatheter aortic valve replacement is what the caller is talking about, TAVR, and that's so. What we traditionally have been doing is surgical aortic valve replacement, which is open heart surgery, either open heart right in the middle of the chest, a sternotomy, or through the side of the chest, which is a little bit less invasive. Nonetheless, is surgery. So surgical aortic valve replacement has been kind of the conventional approach to treating patients with aortic stenosis, and that's what I was just talking about, which is the aortic valve is not opening well. But over the past, I would say, few decades, there has been this improvement in technology, and since 2012 or 13, I believe, approved by the FDA, is a technology called TAVR, and that is placing a valve from the groin and implanting it in the aortic valve position. So it's essentially a valve that is kind of compressed on a catheter, and you push that catheter under X-ray and under echocardiographic, which is ultrasound guidance, into the valve position and expanding the valve. And essentially you have a new valve set in there. Now, there's been a ton of studies on this. It has been shown to be better than surgery, perhaps, in very high-risk population of patients, and even in kind of moderate risk. In low-risk population of patients, and these are sort of things that we evaluate the patients, what sort of risk they have, it's been shown that it may be also equivalent in those patients. So it may be as good as surgery. Now, one of the things that is we don't know quite what to do with is patients who are relatively young, like the caller, 6 or 7 years old. What do we do for those patients? How our decision making really comes down to how long do these TAVR valves last? We don't know that answer yet. Versus how long do these surgical valves last? We know that. Surgical valves can be around for a long time, so we know what the longevity is of these surgical aortic valves. They last, 10, 15 years on average. These TAVR valves, we don't quite know how long they last. So I don't want to speak to the individual patient caller because I don't know the history and et cetera, but we kind of have that discussion with the patient about what we do know, what we don't know, and we kind of individualize that decision making with the patient and figure out what to do, what's the best decision to make. So it is a little challenging, I would say. Now we are kind of in an unknown area, particularly in patients who are in his age group.
Well, Howard, I hope that information helps. You can take that, you got a lot of info to work with there. And take it back to your cardiologist or interventional cardiologist or heart surgeon. And, hopefully that can make the decision. Yeah. And I think it's great that 67 is young nowadays, Dr. Khalili and Howard.
Yeah. It's a new 40.
Since they've been doing studies since 2012, can we safely say that the TAVR system way to do it, that the valve is good for at least 8 years at this point?
So, yes, from the studies that we have, you're about right. The longevity of a valve we know is probably good up till about 5 years, at least as far as the latest studies, if I recall correctly. So at least 5 years. Again, the experience with it is not quite as extensive as it is with surgical valves. That's why there is a little bit of hesitancy, I would say, with recommending it for everyone, particularly a bit younger patients.
All right. And also, just one other quick thing. If, in fact, it goes bad after 5 years, can they go in through the groin again, make an adjustment, and get another 5 years? Yeah,
you're absolutely right. So we can do what's called, we call it valving valve, which is we put another valve inside the old valve. But as you can imagine, if you keep doing it, the valve's going to keep getting smaller and smaller and smaller. We can't quite put the valve that's as big as the first one. So it's kind of like a Russian doll kind of effect. So ideally, we want to avoid it as much as possible. You may end up getting a couple of valves in there, but we can't put infinite number of valves inside the other valves. So we try to minimize that. But you're absolutely right. That is definitely an option.
Thank you, doctor. Appreciate it.
Absolutely.
Well, and thank you, Howard, for calling. That's a great question.
That's a
and
great
Dr.
question, yeah.
Khalili, great information as well. Well, I better take a commercial break or else, so we'll talk on the other side a little bit more with Dr. Khalili and his areas of interest in interventional cardiology on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor show. We're here with Dr. Houman Khalili, Interventional Cardiologist, Tenet Florida Cardiovascular Care. That's tfccheart.com. And on staff at Delray Medical Center. His office is located in the new Delray Medical Center Tower, 5352 Linton Boulevard, Suite 100 in Delray Beach. Yeah, that was a great conversation we had there, starting with the TAVR, but there's other structural heart procedures as well available today.
Right. So the TAVR is I would say the most established structural procedure that we do, and is the most common, I would say, structural procedure that we do, and is definitely very satisfying. There are other procedures, however, available. So we talked about mitral valve regurgitation. That's so you can have stenotic valves, which is the valve doesn't open, and you can have leaky valves. And mitral regurgitation is another valve that's located right a little bit before the aortic valve. And the most common problem with that valve is that it becomes leaky. And it turns out actually mitral valve regurgitation is the most common type of valve disorder that we see in patients. So over the age of 70, over 45% of the population have valve problems. So have mitral valve problems. And again, the traditional therapy for that has been surgery, mitral valve open heart surgery, again, or minimally invasive heart surgery, where they replace the mitral valve or repair the mitral valve, where the surgeons actually can do that. Not everyone is a candidate for it, and certainly patients who are a little bit older and have a lot of other illnesses, it may be too high risk for the surgery. So there is a way we can actually repair the valve with catheters, kind of a similar fashion with the TAVR. We go from the groin and we put what's called a clip. It's essentially what's called a mitral clip, and we kind of cinch the leaflets together where there is a leak, and we kind of we stop the leak from happening. And that is a good option in patients who have mitral regurgitation and are not candidates for surgery. Even more importantly, in patients who have heart failure, leaky valve is quite a big problem. And up till recently, we didn't really have good options that changed the symptomatology of these patients or made them live longer or make them feel better. Even surgery was not able to achieve that in these patients. Within the past year, there was a big study that came out and got published and got a lot of media coverage that MitraClip, same technology, when applied in patients with heart failure who have leaky valves, not only makes them feel better, keeps them out of hospital, but actually saves lives. So it's an incredible technology that has been shown now to improve survival, make people live longer in patients with with heart failure and leaky mitral valve. So that's another one of the procedures that we do, and we're doing it more and more in these populations.
Amazing interventional cardiology information here tonight. We have one more caller. Are you up for one more?
Oh, yeah, absolutely.
All right, Ted, what's your question for Dr. Houman Khalili?
Hi, thank you for taking my call. I had exercise-induced angina while working out on the Stairmaster in August of 2018. And after it happened 3 times in a row where I couldn't go above 113 beats per minute, where I usually did a half an hour to get to 130, I got a referral to a cardiologist. They put a stent in my LAD, which was 85% blocked. And I'm on Brilinta, Lipitor, baby aspirin. Started out on 90 of Brilinta BID, and now I'm on 60 Brilinta BID. Still on the aspirin and the Lipitor, 40 milligrams QD. And I'm wondering, I've been on the Brilinta now for 15 months, and I've seen some 6-month, 12 months, and 30-month studies about when you can eventually get off this stuff. And I'm wondering what your opinion is.
That's a great question. So the Brilinta, or ticagrelor, which is the generic name for it, is a medication that is what we call antiplatelet medication. So it stops the platelets from kind of becoming sticky and sticking to each other. And more importantly, patients who have coronary artery disease and had stents, a stent is made of a certain type of metal, depending on what sort of stent it is. And when blood is exposed to the stent is rather exposed to the blood, it likes to form a clot, right? Blood doesn't like that. So when you place stents in somebody's coronary arteries, we put patients on these sort of medications to prevent the stent from clotting off. And also the other aspect of these blood, I don't want to call them blood thinners, but antiplatelet medications, is that it also reduces risk of heart attack. And a heart attack is mediated by somewhat of a similar mechanism, which is you have a cholesterol plaque, it ruptures, and you have platelets that become sticky and they kind of block the coronary artery. So there are two folds why we place patients on ticagrelor. One is to prevent the stent that was implanted from clotting, and 2, to prevent a heart attack from happening. Okay, so and traditionally, what we've been recommending to patients is 6 months or a year of these antiplatelet medications, ticagrelor being one of them, to prevent the stent from clotting and also reducing risk of heart attack. Now, there are long-term studies, in particular with the ticagrelor the caller is talking about, and I believe the name of the trial was Pegasus trial, where they looked at let's extend the duration of these antiplatelet agents, and would that have any benefit for patients? And it seems like yes, there may be a reduction, not necessarily in what we call survival, but maybe a reduction in the risk of myocardial infarction, which is a heart attack in these patients. And there are also some different trials looking at duration, how long do we follow them? And again, it's individualized. Every one of these trials, when you look at the duration, 12 months versus, for example, 30 months, it all has to do with the individual patient, what are their risk factors, and the type of stent that's implanted. Overall, I would say if the bleeding risk is low, meaning that the risk that a patient would have bleeding from these medications, because they do increase the risk of bleeding, probably a prolonged duration of this medication may be beneficial. But again, it all depends on the patient's individual risk factors and et cetera.
Well, Ted, I hope that helped you out a little bit. And it's hard to believe, but we're already through the whole night. I want to thank Howard and Ted for calling in. And if you like to look up Dr. Houman Khalili, Interventional Cardiologist, it's Tenet Cardiovascular Care. It is at the Delray Medical Center. He is on staff there, the Delray Medical Center, Tower 5352 Linton Boulevard, Suite 100, Delray Beach, Florida. So that's where you can find Dr. Khalili, tfccheart.com. Thank you, and we'll see you next time on the You and Your Doctor show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-4444 5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.